friends, welcome to Time with Thebsian. Today's episode is on X-rays. X-rays, we are very familiar because we might have come across our life about X-rays. Ourselves or some of our relatives might have to do X-ray of broken bones or of our teeth. Even now, dentists are making use of X-rays in plenty because they don't want trouble. Before every extraction or filling of dental materials, they order an X-ray of the particular teeth. X-rays are rays with lot of energy and they have radiation, and that radiation is called electromagnetic waves. If X-rays are passing through our body, it can form images of our different parts of our body, and depending upon the thickness and thinness of our tissues, the shadows will be black and white. The most familiar use of X-ray is in checking fractures, broken bones, and problems with teeth. X-rays were discovered in 1895 by W.C. Röntgen. He says it was an accidental discovery. X-ray machine sends a beam of energy or X-rays through the body. So the hard density bones block the beam, so they show up as white on the X-ray films, and the soft tissues will appear black. But definitely an experienced doctor can study an X-ray and pinpoint problems in the intestine, liver, lungs, bone. If you go in the detail of the use of X-rays, damage to bones and skeletal system, bone cancer, breast tumors, enlarged heart and blood vessels, digestive problems, lung problems, and blockage of blood vessels could be very easily pinpointed or diagnosed with modern X-ray technique. Further, it is used in the definition of fractures, bone infections, osteoporosis, osteomyelitis, arthritis, tooth decay, tooth refall, and when children swallow some items, it can be followed up to pinpoint the item by X-ray, and foreign items lodged in the human body also could be located by using X-rays. You can see an ordinary X-ray image of lungs here. There you can see black and white picture of the lungs. Next picture is of the abdomen, where different tissues could be identified by the doctors, especially the vertebral column and the hip bone. Different X-ray types are used for diagnosis. The order, if you are having pain in your breast, doctor may order a mammogram, and if you have problem in your intestine, doctor will order a barium X-ray, and you will have to drink a barium meal, and the X-ray technician will take different X-rays at different time lengths so that barium meal will be traced up to the anus, so that any problem or any type of tumors or growth or any large item in the intestine could be differentiated or diagnosed with the barium X-ray. Mammography X-ray will diagnose tumors of the breast. Early diagnosis of the tumor will help the patient to have earlier treatment and can be saved by further surgery or radiotherapy or chemotherapy. The computer tomography is the use of X-rays in another form, that when you go through the computer tomography examination in a machine, the affected portion is X-rayed thousands of times by the moving machine, and these photographs are studied by a computer. So CT scan is another method of X-ray examination, and I think that there is another video about CT scan where you will learn. Fluoroscopy is another use of X-ray. Here you may call it as an X-ray movie because the procedure shoots a continuous X-ray through the part of the body so that the doctor will be able to guide the machine he is going to use on you or the therapy medicine he is going to use so that he can see how and where the medicine reaches. See, we may think that X-rays are bad. Yes, definitely they are bad. But we are using them to find out various sicknesses which are more hazardous for us than the dose of X-rays we have to face when we go on undergoing X-ray photographs or fluoroscopy or CT scan. The effects of radiation could affect more on the X-ray technicians, doctors who will spend more time in the X-ray lab or X-ray machines. And the main effect is redness, changes in the skin, irritation, then sterility. The reproductive organs will become sterile. They may not be able to have children. So those are very severe health hazards. Presently, they have preventive methods to protect X-ray technicians and doctors from all the hazards. Modern techniques and equipments are available. And naturally, we get radiation. We are exposed to radiation in the nature. Every day we get 0.1 millisieverts. That is about the 10 days of natural background radiation. It is not more than what we adult chest ray, we get 0.1 millisievert X-ray. That is equivalent to 10 days of natural background radiation. Friends, so I am planning to wind up today's session on radiation. Radiation is a very common word, and we know that we are not exposed to high level of radiation during any kind of medical procedures used for diagnosis. We may take more radiation in more doses when we undergo radiation therapy for cancer or fluorography for some other disease. So friends, kindly send me your questions. If you have any specific doubt about any point in your experience, you want to know more about a particular point, kindly call me or mail me. And it will be very good of you to like my program and may inform your friends regarding Time with Thebsian program on biomedical devices. Please like my program and share them so that I will have more viewers, which I request you to do because a lot of people should take my effort and understand and become empowered with the details of biomedical devices, so they will be able to be careful when they have to use a biomedical device. Thanking you once again, I close this session for today. Thank you.